Alright, this isn't the best angle of me, but I don't really care because I haven't been doing greatest angles anyway. So today I was cleaning my apartment because they're doing a surprise inspection. They gave me 2 days, really. It said 9 a.m. on the letter, but really I was here until 2 p.m., so he must have come at least after that. Anyway, I'm cleaning my apartment. It's a freaking mess because I've been very depressed. Obviously, losing mom, this has been really super hard on me. I'm not saying that it hasn't been hard on other people. That sounded like I put that emphasis on that it hasn't been hard for other people, but it's been really hard on me because I was, her primary caregiver, and then all of a sudden it's like she's gone and there's nothing I could do about that, and I still feel guilty, and I still feel sorry for her, and I still want the best for her, but I have to realize that she's no longer here with us. And so it kind of puts me in this place of like, I don't know what to do, I don't know how to react, I don't know how to behave. A lot of the time, Monday through Friday, since I am currently off school and I do have the summer off, I'm just sitting here watching TV, like Hulu or Netflix or something, a show, right? Or YouTube, so that I can kind of just forget about things. Or I'm thinking about it. I'm thinking about mom, and I'm trying to compartmentalize my feelings so that I don't go nuts, like trying to figure it all out. Well, anyway, cleaning today, I found this. I don't know if you can see that. It says final report. And this right here talks about, this was the document that they gave me. There's 2 pages. This was the document that they gave me in regard to mom's last test. I was reading it, and I know when I read it in the hospital and when I took it home that same day and the next day, I read it a couple more times, and I didn't understand it, like I didn't want to understand it. I knew what the doctor had told me, and that was it, but I just went through it right now, and it's pretty hard to read because of everything that she had going on. So they did a CT of her abdomen and pelvis, and they did it without contrast because she's allergic to iodine. And they have the findings listed kind of like in paragraph form, which is like all of the medical stuff that I don't know that I had to look up, right? And then on the next sheet, they have like a condensed list of findings right here. So it says, findings: dense dependent atelectasis, trace right greater than left pleural fluid. So what does that mean? Atelectasis, or however you say it, is basically collapsed lung tissue. Basically, that means that she had a lack of volume in her lung. It was going to be hard for her to breathe. She was struggling to breathe, and she had a high heartbeat, and kind of slightly lowered oxygen most of the time that she was in there. The pleural fluid, the pleural lining of the lung is kind of the outside lining of the lung, and it can sometimes fill with fluid if there's something going on with the lungs, and it can kind of push down on the lungs and collapse them further. Usually that's a sign of infection of some sort. Like you think about pneumonia, you think about bronchitis. Those are all infections that you get, and then they build up this fluid, this mucus or whatever in your lungs, and that's usually, I believe, what happens with this as well. Diffuse heterogeneous hypodensity throughout the liver. Basically, from what I was reading, it sounds like that's just the liver has a lot of additional fatty tissue attached to it. With, if you look up fatty liver, there's reasons that you could have fatty liver. A lot of times it is due to cirrhosis, due to alcoholism, but also it can happen if you have a lot of cancer disease. The spleen is enlarged, measuring up to 13 centimeters in maximum craniocaudal dimension. That's just saying from like the top to the bottom, craniocaudal. And 13 centimeters, I think typically a spleen is like, I don't know, 6 centimeters, or I'm sorry, something like that. I can't remember. I think it's 6 centimeters. So it was almost like double the size. Whatever it is, I could be completely wrong because I read a lot. And I don't remember everything per se. Adrenal glands are intact. That was good news. Pancreas is intact. That was also good news. There's thickening throughout the peritoneal surface. The peritoneal surface is, okay. How do I say this? There's typically like a layer right here, that is, I think they consider it connective tissue that really protects the organs inside of your abdomen. She was swollen, and when you kind of pushed down her abdomen, she didn't have a whole lot of pain. I mean, comparatively, she was in a lot of pain anyway, and she was on medication the entire time. But when you push down her abdomen, it was hard. Like, she had just eaten like a full meal, and her stomach was just like, or her intestines were just like compacted, like with all this food. And that's not what it was. It was that lining was thickening, and it was becoming dense. Subcutaneous reticulations throughout the mesentery peripherally. So subcutaneous, like meaning under the skin, right? And then reticulated tissue, again, is connective tissue. So any connective tissue inside of her abdominal wall, that was connecting any of the organs, including the intestines, the stomach, all of that, was starting to basically be seen as diseased. And then, let's see, mesentery, I don't remember, so let me Google that really quickly. Mesentery, bam. Oh, the mesentery is a fold of membrane that attaches to the intestine, and it attaches the intestine to the abdominal wall. So that's, again, it's connective tissue that is there, that was being affected. The left-sided pigtail perigastric drain is no longer within a discrete fluid collection. So basically just saying that her drain was no longer working. I mean, we knew that. We could see that. It was obvious. There is diffuse mesenteric edema and ascites tracking into the pelvis. This one gets me because back in January, when she started having some abdominal swelling, I was looking up all of the options of what it could be, and I saw ascites was an option of what it could be, and that it was likely the ascites because we already knew that she had a diseased liver, and that the liver had a lot of abrasions on it, and then if it had those abrasions, if it had little, like damaged pieces or parts to it, then it could not function properly. And if it doesn't function properly, then it pushes this fluid out into your abdomen. And so it's a often seen with liver disease in general, but it can be seen also with liver cancer, metastasized liver cancer also, not just originating cancer. So back in January when this was happening, I got really concerned because Mom was never that big of a person, especially in the abdomen. She had a hernia a while back, and I don't know if she ever had it resolved. She might have. I believe it was in result to child labor or going into labor with one of us. And so she kind of had a little bit of a puff there. But that's just natural after having kids anyway, right? That sometimes that skin and that abdominal area is stretched out a little bit, and if you don't like exercise properly, that could kind of stay puffy. It also just depends on your body. But back in January, she kind of swelled up quite a bit, and she had a lot of swelling in her legs and her feet, her ankles, and she already had a lot of those kinds of symptoms, when she had joint issues, because she was always told that she had rheumatoid arthritis when she was little. And so, of course, like, she was like, this isn't super bad. I don't think it's a big deal. And so I called her doctor for her. Of course, they didn't tell me that my stepdad was going to call the doctor at the Cancer Treatment Center of America. And so they're like, we'll try to give them a call, and they tried to call my mom, and she was sleeping, of course, because she was tired from her treatments. So then I texted my brother, and I said, hey, I mean, because I was going out of town, otherwise I would have been there, and my godmother was coming into town, so this was like an opportune time for me to have some time away as a caregiver, because I trusted my godmother to be there for her. And I texted my brother and I said, hey, I'm really concerned about this. It could be really scary. It could be, the liver can push the liquids to the abdomen, which normally is not too bad, but it could also push the liquids to your brain, to your lungs. And that could just make you have a stroke or an aneurysm or just stop breathing, like, because you have your lungs filled with this liquid. So I was really concerned. And I did ask people on the cancer support group that I was on, the liver one, what do you do? And they said, take her to the hospital right away, get her into emergency care, urgent care, because that could obviously affect you. You could go blind, or you could have a heart attack or whatever, right? Because it depends on where that liquid goes. So I was concerned, and I told my brother, can you have her call the doctor back when she wakes up? And then she got, I guess, apparently, I don't know firsthand, but apparently she got mad at me that I had called the doctor because my stepdad had called the doctor either before or after that, because I was telling her I was concerned. And she was like, it's fine. The doctor said I could go in on Monday, because this was a Friday. And she was going in on Monday anyway, because that was when her next round of chemo was going to happen. And I was just like concerned, and I didn't think that it was a good idea to wait, but they waited. And so when I read this, and I read that she had basically ascites, and that was part of why they kept her in the hospital. That's part of why they kept her in the rehab center, because she had ascites that was so bad that she was very swollen. So they kept giving her the TPN, which is the food through IV, and they kept also giving her tons of electrolytes, so that when she was flushing it out, when she was on the Lasix to flush out the water, they also had to replenish her electrolytes, and they were dangerously low at one point. And then they got them back up right before she went into the rehab center. They got them back up to like pretty normal levels, but she was still having lots of edema, lots of swelling because of this fluid retention. So that when I read that, and then it's tracking into the pelvis, like meaning it's going into, this general area, she's having a lot of swelling here. I just remember that was true, that I saw her like that, and that makes me very upset that, that like, I called it. I'm not trying to say like, I told you so to anybody. I'm just trying to say like that I did the research myself, and I knew exactly what doctors did. And I was concerned about it like a doctor would be, but, my mom had to learn how to take care of herself, and she had to advocate for herself. And so when I was concerned about things, she wasn't necessarily concerned about those things. And I think that if she knew what would happen now, she would have taken care of things sooner. But that's also how I believe she got the cancer as late as stage 4, because she didn't advocate for herself. She didn't go back to the doctor in July and say, this isn't what you told me it is. I'm still having these symptoms, and the symptoms are not related to diverticulitis. So I don't know. I'm not trying to tell anybody that I told you so. I'm not trying to tell anybody, you should have done this, you should have done that. Like, of course I feel that way, but like, it's not going to change anything because I can't go back in the past. I can just feel guilty for not pushing harder, maybe. And I don't want to feel guilty for that, but I have to let it go. And like, doing this blog and reading these papers is the only way that's going to help me to process this. So that's why I'm doing this. Oh goodness. Okay. Let me try. I am at, let's see. Sorry, there's like tears in my eyes. So it's saying nidus of free air is in the mesenteric fluid collection extending into the deep pelvis. So it was further adding on to that edema that she's having from the ascites. Just saying that there could be areas of infection because there is, if there's free air in there, then of course that can feed bacteria that could be dangerous. It says that the last thing says bladder is decompressed by Foley catheter. So they found that out. I mean, they had problems with her catheter. They had to take it out and put it back in and take it out and put it back in. And then she was leaking. And those last couple of days when she was leaking or when she felt like she had to go, but it didn't feel like she had a catheter in because her bladder was decompressed, or when she had all of a sudden urgency and she felt like she didn't have the catheter in, or she felt like she had to go to the bathroom for whatever reason, she was very adamant about getting out of the bed, going to the toilet, and she just couldn't do it. Like, her body, like, with all of the caking that was happening in the abdominal wall and all of the connective tissue, she got heavier because that, like, she had the fluid in there, plus she didn't really have the ability to move her abdomen, so she was heavier and less mobile. It just makes me really sad because I don't think anybody should have to feel like even the bare basics of like going to the bathroom is something that, they're embarrassed by when they're in a situation like that. And I knew she was embarrassed. Like, she definitely, like, had leaking from the catheter and stuff like that a couple of times, and she just felt like, a child. And I just want you to know that if you are in a position where you ever have to be at the doctor and you accidentally go to the bathroom on yourself, like, you don't have control over that, and you shouldn't feel guilty about doing that or embarrassed. Like, just make sure you're getting the help that you need at the doctor, regardless of what happens. Like, it's fine. It's fine. Oh, sorry. I have like one more paragraph and then basically the bullet points. Kidneys are intact. That was the one thing that she did leave from Chandler Regional. People were like, her kidneys are perfect. And they were thinking that if she was having major issues, that her kidneys would give her a lot of problems. There's no hydronephrosis, which I didn't even look that up because she didn't have it. Partially visualized ureters are normal and coarse in caliber. That's great. Retained contrast in the region of the transverse colon and splenic flexure. That's basically saying that even though they did without contrast CT, they were still able to tell that there was something wrong in that area because the contrast was so different. And it also mentions that there's underdistension and wall thickening of the transverse colon, which the transverse colon connects, again, the back of the colon to the abdominal cavity, basically stating that she did have a tumor there and that it was thickening into the connective tissue, and so therefore it was diseasing that tissue. He does also mention that she has a diverting right lower quadrant colostomy, which she did have at the time. There's a fat-containing peristomal hernia, which that hernia could have been the hernia that she had from when she was pregnant. As I mentioned, she did have a hernia. That also could have been if she did take care of her hernia earlier, which I don't honestly know. That could have been what happened when they went in. They went in vaginally, and they did an ultrasound from inside to kind of take a look at her ovaries and her uterus and make sure everything was fine. And that's kind of how they found that there was another mass on the ovary. But when they did that, she said that she felt kind of like right in the middle of her, where her uterus would be, probably on that wall. It felt like something had pushed out, had torn, and it was painful to her, and she was dealing with that pain, and she was very upset that that had happened. And so it could have possibly been a hernia that was created when she was at Chandler Regional. There was, let's see, some diffuse anasarca. I think the anasarca, I believe that is, I'm looking it up, don't worry. I believe that's the liver again. Yeah, generalized form of edema that is severe and widespread subcutaneous tissue swelling, usually having to do with cirrhosis of the liver or liver failure. Great. I didn't actually look this one up. This one says osseous structures are grossly intact. So let's take a look at what that is, because I have no idea. Oh, osseous, like osteoporosis. Got it. So bones. Bones are grossly intact. Okay. Grossly intact. Like, that sounds weird, but it means that by basic visual examination that something seems to be in proper shape. So it seemed like her bones were okay, which is good, because when they did talk to us, they said it could be in her brain, it could be in her back, it could be in her abdomen, it could be in her lungs, it could be in her breast tissue, it could be in her bones. They said all of those things. And the fact that her bones seemed okay, I hope that's true, because I hear bone cancer is very painful, like marrow cancer. What just happened? Sorry, I don't know what just happened. My computer just started playing music. Okay, and then the impression, right? So here's the synopsis. Left paragastric pigtail drain no longer appears to be within a fluid collection, so it was no longer producing fluid. Diffuse mesenteric edema and proteinaceous ascites with increased pelvic confluence of the fluid collection in the pelvis containing innumerable foci of air concerning for infection, which I did mention, that the air pockets, there wasn't a lot of gas in there. It says right here, greater than expected post-surgically. Findings could reflect enteromy, which means that it was result of the surgery. However, there's not a lot of pneumoperitoneum, which means that there's not a lot of excess gas. There's just excess air. And that being the case, like, that could create more bacterial infection. There is a persisting concern for leak. Consider oral contrast enhanced study with delayed imaging. So basically the doctor put that in to cover his butt, to say you probably want to get more imaging done, but at this point we kind of knew what was happening. Extensive peripheral peritoneal caking or inflammatory changes, likely a combination of infection and third spacing or volume overload. Continued followed up, recommended to ensure resolution that this does not actually reflect peritoneal carcinomatosis, which it did. Peritoneal carcinomatosis is basically a pretty rare cancer that can basically develop gastroenterology or gastrointestinally, or through your female parts, so gynecologically, I guess. And basically they grow in the peritoneum, which is that lining of the abdomen, and it covers kind of all of those abdominal organs. So basically what had happened, from what I'm reading here, is that her liver, her ovary, and her colon, which were all known to have tumors of cancer, had probably spread to that abdominal lining, and then that abdominal lining was spreading the cancer literally all over. Once it gets into the lymphatic tissue, then of course it's traveling everywhere through the blood. And he just said continued follow up to recommend that we could find a resolution, but of course it ended up being peritoneal carcinomatosis, diffuse hepatic metastatic disease, which is just saying that her liver was producing the ascites because of cancer disease, dense atelectasis and trace bilateral pleural effusions, basically again saying that she had the collapsed lung, she was having issues breathing, and that there was some fluid in there. Spleno, I don't know how to say this, splenomegaly, I don't know, something like that, which is basically the increased size of the spleen. And I was looking, because usually an enlarged spleen is not necessarily something that is going to be life-threatening or whatever, but it did say that it is likely to be caused by bacterial or viral infections, or cirrhosis or other diseases affecting the liver, or it could be also a sign of blood cancer. So this also could be that it had gotten into her lymphatic tissue, it had gotten into her blood, and it moved, it's trying to be filtered out by the spleen, which is why the spleen enlarged. Foci of pneumoperitoneum outside of the fluid collection, possibly from patient's drain, or more likely from receiving diverting colostomy. That pneumoperitoneum, or basically pneumatosis, so that's the abnormal presence of air or some other gas, was in the peritoneal cavity, that abdomen. And that's what it kind of goes back to number 3 that says extensive peritoneal caking. And they call it caking because the little air bubbles in there basically make it look like sponged cake, like you creating like a angel food cake or something, a very fluffy, like airy cake. But then you also have that dense tissue in there that was hardening. So it was like a combination of those two things. And this was dictated at 6:14 p.m. on 3/12. And so basically, her doctor was Dr. Majeed at this location. This was at the rehab center. And basically he came to talk to me about all of this. And when he did that, that's when he said, like, it's a mess in there. I mean, he literally said, it's a mess in there. And then he said, I don't like it. And I'm like, great. Because if he was any other stupid, asshole doctor, I would have said, fuck off, you're wrong. There's nothing wrong with my mom. But of course, I knew. I mean, I was so happy that for my birthday I got to see her move to rehab, and then I thought, like, okay, she'll be going home in 2 weeks and this will be it. And then all of this happened, and I obviously still have a lot of feelings and emotions surrounding like that day, and him talking to me, and he was trying to be like, I'm telling you, like, this is it, like, I don't have any good news, but he was being very kind and very, like, trying to not really sugarcoat it, but to deliver it in a soft way, because nobody wants to hear that. Nobody wants to be able to, or nobody can, like, process that. And so I'm just like, yeah, I'm fine. Yeah, I'm totally, like, and, like, as soon as, he kind of said it, like, I knew what he was saying, and I let it sit in. And then, like, that was right at the end of talking to him. I just started silently crying, and I was like, thank you so much. I appreciate your honesty, because what do you say in that situation? then he left, and it was him and I believe it was a chief nursing officer and also my mom's social worker. And then they all left, and they were just like, "We're sorry, you know, take whatever time you need." And I was like, "Okay." Um, and then I went into that room and I just started crying, and I think my mom felt that I was there, was facing the other way from her. But there was a curtain there that divided up the two rooms, and I just started crying. And then she was like, "What's wrong?" Like, it was hard for her to speak at that point. She was like, you know, "What's wrong? Like, why are you crying?" And I turned around and was like, "It's nothing, Mom. It's just that I love you." And then she's like, "Oh." And she kind of turned back to, you know, the other way, and kind of fell back asleep, I believe. I wasn't really paying attention to anything except that she was comfortable. And I just started bawling, and then I had to talk to my godmother, and then I had to talk to my brother and my grandparents after that. Because that was the burden I was given. You know, and as much as it was very difficult to tell all of them, it was given to me. It was given to me. Like, it's a burden. But it was a task given to me by God. You know, if you believe in God, great, you understand. If you don't, then just feel that it was a task that I was given by way of circumstance. Like, it was a reason, there was a reason that it happened, and I have to learn from it, and I don't want to fail my mother by not learning from that situation and not growing from this situation. But this has been the hardest thing I've dealt with in my life. And I've dealt with quite a few tragedies, quite a few traumas. I go to therapy for a reason. This has been the hardest thing. And I hope that someday, even though it still evokes pain, because pain is a reminder that we love those people so much that we miss. I also hope that most days I don't think about it like that. I don't think about my mom like that. I think about her as the person that I appreciated throughout my life while I had her. And so that's a lot longer of a video than I thought it was going to be, but let's upload that because I am done crying on camera.